Welcome, everybody. Looks like we've got people still joining, so we'll get started here in just a minute. Okay, looks like the numbers are slowing down a little bit. We'll get started as a few more people join. Good afternoon, everyone. My name is Tim Gillette. I'm the Deputy of Operations for both the Child Welfare and Self-Sufficiency programs, and I'm glad you're all here today. I do use he, him pronouns, and I'll be your facilitator for this staff chat. I hope you all are enjoying your spring this year. In the chat window, you should see the question, what's your favorite thing about spring? Mine is being able to get back outside and enjoy the weather with my kids. And then we're about ready to get into the meat of this. We do have a few more people still joining, and I see the chat is going crazy, so that's awesome. Let's talk about a few logistical details as the last folks join. Our meeting is being recorded. As you can see, we've got ASL available here. We also have captioning if you go to the CC button at the bottom of your screen. And you can click on that to get to the live captioning. I'd also like to mention a few housekeeping details as we get started. There is a Q&A function that's available for questions. If you put it in the Q&A function, we will see those as your panelists will see those and be able to respond accordingly. We may not be able to get to all of those today, but we will follow up. Also, a reminder, this webinar is being recorded. So if anyone needs it later, we'll be able to access it. For our agenda today, the executive leadership team is going to provide some updates about our newest team member, talk about person management changes. We're going to hear from a team from D1 on their CQI efforts and next steps on the Doris Duke Foundation grant. Please note that we appreciate all your questions. We will answer those that most broadly apply to all staff. With that, let's get started. April, going to hand it over to you.
Thank you so much, Tim. This is April Flint-Gerner, she, her pronouns, and I want to thank you all for joining with us today. So my favorite thing about spring is, well, my name is also signifies my birthday. I love tulips, I love baby birds, I love being outside, I love Mother's Day. I genuinely love spring. So it's been a really busy year so far, and I'm happy to share with you some of the exciting updates that we've got. In March, we officially welcomed our newest deputy director, our very own Molly Miller, to the team. I am sure many of you have met Molly, but I want to give you a brief overview of what she brings to this executive leadership team. Molly began her career 22 years ago with self-sufficiency before moving to child welfare. She first worked as a caseworker and as a CPS supervisor, and after a decade in these roles, she became an operations and policy analyst for our central office safety program. She helped to design guidelines, procedures, administrative rules, and helped to lead initiatives including suicide prevention and the integration of safety science into our critical incident review process. She also was a program manager in District 16, shout out Washington County, in 2021 and oversaw the permanency certification and family time program. With the help of her leadership team, she established systems that helped to reduce the use of temporary lodging. She collaborated with our Office of Equity and Multicultural Services to help address bias and systemic racism in the permanency planning process, and helped to improve data outcomes, including the timeliness of family reports and face-to-face contacts with children and parents. This process that we put Molly through was very competitive with multiple rounds and community input, and we could not be happier about having her join us in this important work. say hello to my little friend Molly. Would you like to say a few words?
Hi, everyone. Thank you so much, April. I am really excited to be here, working with this amazing leadership team. My favorite thing about spring is spring skiing, though I haven't had an opportunity to do much of that. It's a great way to escape my allergies, which you all might experience with me today here a little bit. When I started working for ODHS, I was fresh out of college. I spent the better part of my early 20s simultaneously growing up as an individual and as an ODHS employee. I often wondered to myself, how can I be responsible for these immense decisions? I don't even have a dentist. But the work has shaped who I am as a person, and I hope that my lived experience and my work experience can also shape the work that we do here moving forward. In the coming months, I will continue to get to know my team. I'll be working on efforts to improve equity training and workforce development. This will include focusing on upcoming initiatives for child welfare that will improve training, retention, and professional development for staff. In the near future, our executive leadership team will also be bringing me into the fold of other discussions with other leaders. And so I'm really looking forward to the work ahead and hope you will reach out to me with any questions. And back to you, Tim.
Thank you, Molly. We're so glad that you're here with us. Happy to have you on the team. Lacey, I hear you have some great news to share with us. Show me the money.
I sure do. Good afternoon, you all. My name is Lacey Andreessen. I use she, her, hers pronoun series. I'm the deputy director. I'm one of the deputy directors for the Child Welfare Division, and so glad that you are here to join us today. You know, life is a lot like a box of chocolates. You never know what you're going to get. And what we got 4 years ago was a pandemic. And unexpectedly, we have learned some things that really benefit families from that pandemic. We had a flood of federal money that allowed us to utilize it in really creative ways to provide concrete supports to families in need. And we weren't the only state who utilized the COVID funds in that way. This has resulted in Chapin Hall, which is a national research and support institute out of the University of Chicago, have done some research and analysis of that concrete support investment. And they have provided research and evidence that supports the fact that concrete supports for a family actually can prevent child abuse. That's struck a lot of interest in our work and our field across the country. And a lot of philanthropic organizations and research institutes are very interested in increasing the amount of evidence around what concrete supports can do for families, with the hope that we can create the level of evidence needed for that intervention to actually be in the family first, the federal FORI use of dollars in that family first bucket. So in that spirit, the Doris Duke Foundation is a large philanthropic organization in this country who looks at doing research and funding into all kinds of family and children supports. And they selected Oregon to be a part of the opt-in initiative. We launched that in March. The first date was March 11th. We were one of 4 jurisdictions in the country that was granted the award, and the other jurisdictions that we're working with include Washington, D.C., Kentucky, and South Carolina. April represented Oregon in Washington, D.C., and she participated in a whole level of different panels at the in-person event where our very own Rebecca Jones-Gaston helped to kick off and was the keynote speaker. April, can you tell us a little bit more about your time in DC doing this work?
Absolutely. I have spent quite a bit of time in DC. As a matter of fact, they are about to just hand me an apartment at this point. The national conversation around child welfare in this nation continues to be one that is focused on reducing child poverty, increasing partnerships and access to quality behavioral health and mental health supports for families, and supporting all of you as a part of the child welfare workforce. And what that means is that we need to do as much as we can possibly do to support children safely staying at home whenever possible. We need to place them with their kin and their kith within their communities and wherever those kith and kin are whenever possible if they cannot stay safely at home. And we need to help them get access to concrete and necessary services to mitigate the risks of child maltreatment and child abuse, to prevent the further upstream efforts that, sometimes don't work. I met with many people the day after the launch event for the Doris Duke work, and many staffers from a bipartisan group of legislators in DC. And everyone is again paying attention to what's happening in Oregon. And I can really confidently say that we will have more eyes on our work than ever and more interest in sharing what we're learning around prevention and family preservation efforts. We're really going to be talking with you all in our next chat about the Child Welfare League of America conference and bringing staff who had the opportunity to go to that event to come and talk to you all a little bit about how much they're hearing Oregon is really leading the nation. So just stay tuned for more. What I learned from all of this in the last couple of weeks is that if it comes from inside you, always write one. Back to you, Lacey.
Thanks, April. During that launch, in addition to April, leaders from all four jurisdictions, as well as our partners with lived expertise, talked about, as you heard April say, concrete supports, the influence and the importance of stabilizing family. We were able to highlight in Oregon the work that we're doing to be intentional about the service delivery between self-sufficiency programs and the child welfare division. And we're really just at the beginning. For this first year, we're going to be designing the pilot program in partnership with Doris Duke and several other people that are helping to support the work. We just held our first meeting with leaders in other states, and we have an advisory committee meeting happening here in Oregon next week. Alongside Harvard's Government Performance Lab, who's partnering with Doris Duke, we're also working to lay the groundwork specifically in District 2 and Districts 11, where the pilot programs are going to be based. I'm really looking forward to sharing more updates with you all about it in our next chat. And we're going to move this work, friends, to infinity and beyond. Back to you, Tim.
All righty then. Thanks, Lacey, for that great update. Thanks, April. And actually, we're going to go right back to April for some more thoughts.
Thank you, Tim. Before we go into a few more updates, I want to highlight a few important milestones during Child Abuse Prevention Month. And you can see we are in full celebration mode with our backgrounds. We really hope that you all have your blue pinwheels and your backgrounds, and that you all are taking a stand for child abuse prevention this month. First of all, many of you know that April 4th marks the 5th anniversary of ORCA's centralization. According to the map, we've only gone 4 inches, but realistically, we have come leaps and bounds further than any of us expected. 5 years ago, 15 hotlines merged into one, and it is operating 24/7. And really at that time, Multnomah County was the only one that had the 24/7 hotline. We really want to congratulate the ORCA team for persevering through the many challenges of that centralization. There is so much impressive data that has come out of that work, and we just want to share a little bit about that. One example, ORCA answered more than 131,000 calls in 2023, an increase of about 7,000 more calls than the previous year, with an average wait time of under 2 minutes. Huge. ORCA also maintained one of the lowest turnover rates across all of child welfare, with an average of 2.2% for 2023. As you know, one of Governor Kotek's directives to the state agencies is to improve our customer service. As the front door to child welfare, couldn't be prouder of how they're modeling customer service and efficiency at ORCA. They have repeatedly been held up as an example of customer service, improvement, and change, which includes consistency, accuracy. You all are doing a fantastic job. And because of these results, leaders across ODHS have been reaching out to learn about how Orca operates and the best practices that have been established. Thank you to Kristen Klon-Hawk, her team of amazing leaders, and all of you in the workforce for this really celebratory time of marking this important milestone. Tim, and you know this, man.
Thanks, April. I've got a couple updates I'd like to share today. The first one is about a recent after-action review that was conducted by our Office of Resilience and Emergency Management, or OREM, last month. The purpose of this review was to provide a neutral evaluation of the department's contractual relationship with Dynamic Life, which served as a provider for temporary lodging, supervision, and prevention. After-action reviews are commonly used in emergency management to conduct relatively quick reviews of events and make recommendations. Our director, Fairborse, has directed leadership of Child Welfare, SSP, OC&P, OTIS, and ODDS to develop an implementation plan for needed improvements. In addition to the after-action review, our ODHS internal audits team has audited our child welfare contracting processes and regulatory controls over contractors and providers supporting children in or at risk of temporary lodging. Based on the results of both the after-action review and the internal audit, several improvement efforts are already underway. We have centralized the management of our temporary lodging contracts. These contracts previously were managed by local offices. Managing them centrally will provide more consistent oversight and accountability. We are developing a consistent statement of work and contract template for temporary lodging providers, including areas like safety intervention and training. We're increasing mandatory training for contract administrators. We're reviewing contract requests for child welfare client services to ensure background check language is included in all of our contracts. While our relationship with Dynamic Life has ended in January, we still have providers available that we work with to support and prevent temporary lodging. Your local leadership works with our R&D unit as needed for support. Moving on to my next update, I'd also would like to provide you with an early notice about an upcoming change that you're going to see in ORCIDS. This summer, ORCIDS is modernizing the person management module to improve usability and data capture. ORCIDS users will see the following changes: new icons, autosave, better visibility of critical data, improved ways to create new person records, streamlined data entry for disability, culture, demographic, and address information, along with a few other tools as well. Please keep an eye out for the release of these new updates. And while we're making quite a few changes here, we promise not to take away your stapler. Prior to the release, we will have facilitated demonstrations for management and staff and additional communications through email and meetings. That's it. If you have questions, please reach out to Lee Brown. Lee and his team are excited to help roll these changes out. Lisa, I believe you're next up with some updates.
Hey, you guys. Yes, I do have some updates for you. But first, Lisa Bender, she, her pronouns, Assistant Deputy Director for Child Welfare. And my favorite thing about spring is the longer days. It's so nice to finish up my day and still see some sunshine. So now for those updates. The legislature passed House Bill 4086 in March with bipartisan support for a review of the scope of ODHS child abuse definitions, the investigative process, due process, and how we work with community treatment providers to support children with problematic sexual behavior in their families. This bill will allow us to convene 2 study committees to look at best practices and prepare to make recommendations to the legislature in 2025. The first study committee will look at child abuse definitions in Oregon compared with other states across the nation, with particular attention to our definitions of threat of harm and neglect. The committee will also consider defining who is responsible for child abuse. Oregon is the only state in the nation that does not define a person responsible for the care or welfare of a child and therefore subject to a mandated CPS assessment. Most states limit child protective assessments to parents, guardians, custodians, caregivers, or others in a role where they are responsible for the care of a child. As many of you know, we commonly refer to those outside of that as the third-party cases. Finally, the committee will consider potential gaps and or duplication of efforts for child abuse responses and make recommendations around more effective coordination during the CPS process between child welfare, SSP, law enforcement, district attorneys, other first responders, and the community-based service providers we partner with. The second committee will look at services to support children exhibiting problematic sexualized behavior. As we continue to make the vision for transformation a reality and center the needs of youth and families, we are often faced with the recognition of where we've caused more harm. Assessing a child and placing them on a registry for sexualized behavior can lead to stigma and limit that child's future potential for success. Therefore, we want to explore pathways and access to trauma-informed treatment services for these youth and their families that would not require a child abuse finding to get help. I also want to quickly give an update on Senate Bill 209 that was effective January 1st, 2024. If somebody wants to put it in the chat, it was actually a House Bill 4086, if someone wants to throw that in the chat. Thank you, Crystal. So back to Senate Bill 209, effective January 1st. This bill allows for child welfare to protect a child's statement about their SOGI. And when we say SOGI, we mean sexual orientation, gender identity, and gender expression. So child welfare now has the ability to either not verbally disclose or not disseminate written records about a child's SOGI without that child's consent, or with an exception that is related to the child's safety, well-being, or in order to provide appropriate services. Training, implementation, ORCID's enhancements, and CQI on this new SOGI law are ongoing, and additional worker training will be available soon. In addition, I wanted to let you guys know if it's not there yet, it will be there real soon, a drop-down box in the ORCID's file cabinet that will allow caseworkers to properly store the SOGI confidentiality consent forms in a way that other individuals with access to the case, including discovery staff, will easily be able to find. In addition, I wanted to remind people the final approved SOGI form has been posted on the OWL site. So if you have any old forms, we had a draft out there folks were using, please delete those if you saved them on your computer and use the current published form going forward. You guys give up yet, or are you thirsty for more? That's it, Tim.
Thanks, Lisa. I believe we're lucky enough today to have some special guests from District 1 who are here to talk about CQI. Alicia, would you like to do introductions? I feel the need for speed.
Thank you, Tim. Good afternoon, Alicia Cox, she, her pronouns, Child Welfare's Assistant Deputy Director. And my favorite thing about spring is when the cherry blossoms bloom. They have a personal and cultural importance to me in my life, and that's one of my most favorite things. I wanted to invite a couple different people with us, our conversation today. But in June of 2020, I was charged to build a vision for the CQI program, and it was formalized and built from the ground up in 2020 and early 2021. And with all of you, and the program started their pilot sites in 2022. We're nearing the time when all districts have now entered a CQI cycle, and some sites have even finished their first year. Life moves pretty fast. If you don't stop and look around once in a while, you could miss it. So today, let's slow down and hear from District 1. We have Tara McLaughlin, Kim Mai, Craig Madsen from District 1, and Nikki Hain from CQI. And we're going to hear talk about their experiences with the continuous quality improvement cycle year 1 in Tillamook and Clatsop. We'll do some introductions and we'll get started. Tara?
Hi, I'm Tara McLaughlin. Are we going? Okay, sorry. I'm the Child Welfare Program Manager for District 1.
And I'm Kim Mai, use she, her pronouns, and I am a supervisor for foster home certification and adoptions in Clatsop County and Tillamook County, and then I supervise the permanency unit in Tillamook County as well.
I'm Craig Madsen. I use he, him pronouns, and I supervise the CPS unit in Tillamook.
Awesome. Nikki?
Hi, my name is Nikki Hain. I am a CQI or Continuous Quality Improvement Analyst. And thank you all for having us today.
Awesome. Well, Nikki, I think you have a little bit of information to share with us, so we'll have you get started.
Absolutely. All right. So we're just going to talk a little bit about what Tillamook and Clatsop did in their first year in their CQI cycle. So CQI, again, stands for Continuous Quality Improvement. And CQI is a systematic, data-driven process that asks really two questions. One, how are we doing in serving the children and families in our communities? And then two, can we do it better and more effectively? And the CQI process uses research and data to track trends, areas for growth, and areas of strengths where ideas could be shared. And our process then creates some action plans that focus on really small change that will impact the way families experience child welfare. So Tillamook and Clatsop counties entered the CQI cycle in the fall of 2022. Last year, they selected the measure of initial placement with KithKin to work on improving during the CQI cycle. So here you can see the starting point in the pie graph on the left. We're looking at the percentage of how often a child's first placement was with kith or kin. And from, might pause for a second, I see Carol. Okay, great. So from October 2021 through October 2022, 28% of the children that entered care were initially placed with KithKin. The graph that you see on the right, that is supplemental information, and this shows current placement in substitute care from October 2021 through 2022. And at that time, 38% of the children were in care that were placed with KithKin. So what did Tillamook and Clatsop do over that year that they were in the CQI cycle to make some changes? They did a variety of things, but here's 4 examples of what they did. Both CPS and certification units tracked barriers to placing children with KithKin. So that way we could learn from the barriers and work through those to place more children with KithKin upon entry into care. CPS workers were asking parents as soon as they could who their supports were in their network to better understand if placement was needed and who they could reach out to. There was an agenda item at all family support meetings to inquire further about supports for parents. And then at group supervision, they discussed successful strategies to further inquire about KithKin placement, and they collaborated together, and that was a really good opportunity to just learn from each other on when they're having success. So then last year, we got to see what happened, what were the results. And so you can see here on the left, if you remember, they started at 28% in 2022 for initially placing with KithKin. And then a year later, after their hard work, they got to 40% of placing children with Kithkin upon entry. And then you see to the right, they weren't necessarily working on current placement, but we can expect that to change too. And if you remember, they started at 38% for that in 2022, and then moved to 44% for placement with Kithkin in 2023. So we saw improvement over the year, and we're going to talk more about what happened. So thank you.
Thank you, Nikki. So with CQI, are you telling me there's still a chance to hear more? We'll just ask a few questions from District 1 about their experience so that we can hear a little bit more about the intricacies of the cycle and learn some lessons from them. All right, District 1, what did you like about the CQI implementation? Any reflections that you want to share from the past year?
I think what I appreciate the most about the process is that it gave us an opportunity to look at something that's really important to us, and understand that we could make improvements, and it provided support, structure in an intentional way so that we could not only like create change, we could follow through with that. We could have an active plan to like make those changes instead of talk about it, which is, you know, sometimes where we get stuck. So it provided us a real pathway to get to where we needed to go.
I like because it's really busy on the front end, and so it caused us to slow down and look at things and be more intentional, like she said, and find different ways to make improvements, see, you know, what areas we were doing well in, see what areas we weren't. And along the way, we were able to change and tailor the plan to meet the branch and the unit's needs while still maintaining the goal of getting better with Kithkin placements.
I was really excited. I got to be involved in CQI shortly after becoming a program manager, and I was really excited about CQI. And I feel like excitement is contagious. But what I really liked about the CQI process is that they're really about engaging with the district and meeting us where we are, and figuring out how to get everyone engaged in the process based on where they are. So really helping people look at data as an opportunity to grow, and learn from our mistakes and figure out how to move forward in a better way, and to not find it threatening, which is really kind of a change that we have to go through. So I really enjoyed that process, and I felt like the CQI team was really there to help us through that, because everybody's in a different stage for that. And so I really liked that about the process.
Thank you. I think one of the things that maybe resonated with me, we had some conversations about your experience before our chat, and then also when Nikki showed up some of the strategies that you implemented. It was, you know, getting right in the beginning, figuring out their network, identifying who in their family could help support them in the space versus waiting longer down in the cycle and down that timeline, which really cut down some of your time in terms of placement. I think that's just a really critical component that maybe we missed, and that you were able to slow down and engage and really build in some trust with the family at the beginning, and that you were able to identify those persons immediately. That, I think, for me was so helpful to hear and better understand how you're engaging the families in a different way.
And I think through that, there were times when kids did not come into care because we were able to engage right from the start and identify people who could create safe plans without us.
Yeah.
It was also important to help the workers understand that they're already asking a lot of these questions and they're already gathering a lot of this information, and that we just needed to find different creative ways to do it, because conversations at the beginning can be hard. So it was important to help them understand that they're already doing a lot of this anyways, and we're just going to document it, take a closer look at it, and see which ways we can make improvements.
Right. I mean, you already know how you're going to engage with families. You already have that skill set and toolbox, but is slowing down and being intentional about those connections. I think that's where you really saw some great growth. And again, avoiding foster care and foster care placement altogether is just a huge win. Thank you, District 1. Another question, which might parlay into the question that we see in the chat. What are some recommendations for getting your team and community on board with CQI? Because Tira said it's infectious, it's exciting, but maybe not everyone's there.
Takes conversations when the opportunity presents itself, especially with the community, like when we're out there and, you know, they're asking questions or they're telling you what they think should be done. Taking those opportunities to have those conversations with them, helping them understand that we need to keep the kids with kith or kin or, you know, family, and trying to identify those. And sometimes when you got them on board, they even had some ideas that maybe we weren't able to explore. So once you started having those conversations, there were other people that were coming out of the woodwork. So you'd start finding resources that weren't there before. And then if you run into barriers, sometimes you would have conversations to try to help overcome those barriers. And sometimes they were easier and sometimes they were a little more difficult, but it was a process.
We had different community members at each staffing that we did, each CQI meeting that we did, whether it was a resource parent or an officer or, you know, somebody else that wanted to be joining in on this because they started to see that we really were putting it out there that we needed their help. This wasn't just our work, but it's our community's work.
I think, you know, really making sure people came to it initially, or staff came to it initially, thinking that they weren't going to have a voice necessarily, or they weren't going to be heard, and it was just going to be another meeting where we already had an idea of what we were going to do. And so I think it was really important for people to come and be part of a process where they did feel like they had a voice, and where they saw that what they said got incorporated into a plan that they got to have access to and see. And then when they came back and they said this plan didn't work the way we intended for it to, or it's too much work, or it's adding to our work rather than taking away from our work, and we're not seeing value, then we changed it. And so they got to see that they had a voice, and that voice resulted in changes happening. And then they were able to see that the plan made a difference in the work we were doing and resulted in a good outcome for families. So as they saw things get better for families and good outcomes, they became more involved. And so the participation from staff increased as we move forward. The other thing that we really were intentional about is talking to our community partners about our vision for transformation, and about how CQI is part of that, and how we really believe that communities have what it takes to take care of their children, and how this is part of that process. And so it's really necessary for and critical for our communities to be part of CQI if we want it to be successful. So we were really intentional about reaching out to people that we had a relationship with in our community to share that message and that information, and to invite them in.
I was going to chime in just for a second to answer this question too, that I think, you know, for just thinking about getting people ready entering the cycle, knowing that looking at data and areas for improvement most likely might feel uncomfortable, and that's okay. Not everyone is going to be excited about it right away, and just knowing that discomfort is normal and we welcome that in this process. And Craig highlighted this a little bit, that we're also going to be talking about your strengths and things that you do really well that might not necessarily be reflected in these numbers that we're talking about. But part of CQI is really just having that organized structure and a system where we are able to lean into those strengths that you all have, and then work those into the areas where we're seeing need for room for improvement. So it really just isn't, it's, you know, the data of it all can feel uncomfortable, but know that we're going to be celebrating and highlighting strengths, and we're going to be looping that in with those areas for improvement.
I appreciate that, Nikki. I think there's, you know, always some worry that when we talk about data that we're going to like circle all the areas in which you're not doing well in, and that's not the case. It's really being curious about that process. In, you know, the noticeable change over a year isn't jumping. We're not tripling and quadrupling our productivity. It's what is sustainable within the workforce, and having caseworkers and supervisors, having Kim and Craig in those conversations with their teams to say, what is feasible and meaningful to you? And what does that look like on a day-to-day basis? Because we're not here to add 5 new processes and intricate layers and challenges and loopholes and things to jump through. It's something that we can incorporate it as part of our daily work, and knowing that it's towards a very specific goal so that we can see that change over time and not those giant jumps that will eventually dip from fatigue, but an overall increase engagement. And I just appreciate how District 1 really showed up around this space, recognized some of the challenges in it, but then really was able to pivot and be flexible in it, and really leaning in on Nikki and the team and the community to continue to build through that work. So I just appreciate you all for coming today and talking about it. Any last thoughts you want to share with the group that we have?
I would just, encourage people. It's such an opportunity to share with our community as our success, but also the responsibility of child safety. And it's just a great opportunity. So I just encourage people to embrace it because it's been really positive.
Love that. Thank you, Tara. Thank you, Craig, Kim, Nikki. It was just a really great honor to hear from the work that you have and your continued energy around this. I'm grateful the team continue to use root cause analysis to look at the issues to really figure out what is it that we can improve upon rather than trying to put a Band-Aid or using a jump to conclusions map. Thank you, D1, Tara, Kim, Craig, and Nikki. Just appreciate you all. And friends, I'm just a girl sitting in front of a district asking them to love CQI. Back to you, Tim.
Thank you, Alicia. Thank you, Nikki. Thank you, our folks from D1. Love it when we get to hear about what's going on across the state and share that with our other districts. So thank you for that. We are going to jump into our Q&A session. So we've got a couple of questions here that we are ready to answer. We've gotten a few questions regarding Molly Miller's new role and what she's going to be doing around workforce and labor relations. Molly.
Thanks, Tim. Well, as you all know, I've been in my role now just a little over a month. And so I think every new position I've had, I've realized very quickly how much I don't know. And it's always a very humbling thing. So the question's great. I wish I had more of a detailed answer for you, but to be honest, I'm still very much in the learning phase of this new role. I believe that having a good partnership starts with having a good relationship, and that relationship is built on a foundation of trust. And it takes time, and it's vital to take the time to build that trust. So in the coming months, April and Lacey will be including me in some spaces with labor leaders so that I can begin building that relationship, listening in on conversations and understanding top priorities, how I can continue to do the work that's already in place and also support additional needs. So engagement and participation over the next year will really be devoted to them getting to know me and me getting to know them.
Wonderful. Thank you, Molly. We actually had a question come in during this chat that we'd like to answer around family preservation and staffing levels. April, do you mind taking that?
I would be absolutely thrilled to. So in short, the question was saying, we'd all love to do more family preservation work and keep kids with their kith and kin, but we need capacity. When are we going to get some help? And that's the short version of the question. And I said, responded back to the person who answered the question and said, we did get a significant investment in positions from the last long session. It takes a while for those positions to actually come into the agency. And so in the next couple of years, we're going to start to feel the impact of increased capacity, particularly with CPS. But the other thing is that every time we get a bunch of, caseworkers, we get the support positions that come along with them. So it's not like we just get, caseworkers and no supervisors or no office support, those kinds of things. So we're going to see, particularly places in the state where we're prioritizing rural communities where it's harder to fill vacancies. We're working on an implementation plan right now for those positions coming into those areas that will really kind of take into consideration some spaces where you all are really needing some help. So stay tuned for more there. And the second thing, you know, if I could take out of my back pocket everything I think you all need, I would never keep it from you, ever. None of us would ever keep anything that we have access to from the workforce. The way that the system is set up, we have to go to the legislature to ask for additional resources. And the legislature has been very, very gracious and generous. And, you know, since we had a huge legislative ask last session, we have to do a good job with implementing and getting those positions in and hired and doing the work before we can really ask for a bunch more. But we do have a director's office and a governor's office that are thinking about you all as a workforce. They listen to us when we advocate. And so we continue to be in conversations about what it is that you all need to feel supported so that we can really build the kind of prevention and preservation system that we all want. We recognize that we can't just keep asking you to do more without either increasing your capacity, taking off some things that you're doing right now. And all of those things are things that we're talking about, improving our use of technology to make things more efficient for you all, so that we can, again, do the good work of prevention and preservation. Tim?
All right, the next is kind of a duo thing here. We've gotten a few comments about relative search letters, and then also some questions about the respite program. Lisa, do you want to cover those?
Sure will, Tim. Yeah, we've heard a lot about the new relative search letters. We've heard from some of you, specifically shouting out Josh Miller for his work on this. So I just wanted to take a moment to recognize Josh for his hard work on the relative search letters. I'm not going to attempt to know all the answers that people have questions about. I encourage you to reach out to Josh or your permanency consultants if you have additional questions about that search letter. But kudos, Josh. There also was a question about what is the latest on the respite program. So as many of you know, I actually came to central office, and that was one of the first pieces of work I did here. And respite, from its inception, the idea behind this program has always been to support resource parents and families of origin. But that obviously had to be a phased approach, right? Because we didn't have necessarily the volume of respite providers that we would need to immediately serve all the children and families that needed respite in the entire state. So in phase one, that was 2023, we launched the certified respite provider pathway and just started certifying respite providers. And at that point, we were looking exclusively at resource parents until we could build some capacity. Currently, the program is in phase two, which launched just in February, where we began certifying respite providers that could support parents during reunification. So not full in-home support, but during that reunification period. And the next step would be phase three, and that would be a plan for how to support parents as a method of prevention or family preservation. So keeping families together. Currently, phase 1 and 2 is intended to support caregivers with those regular breaks and their caregiving responsibilities, and help parents re-engage in reunification in order to resume full time of their children after they have been in foster care. So looking forward to that program continuing to grow. I know I've looked at some of the data and seen that the number of youth served in respite care has more than doubled between 2022 and 2023. So I'm really excited to see where it goes in 2024 and beyond. Back to you, Tim.
Wonderful. We often get questions around what's going on around the legislature. So we'd love to give a quick ledge update from our friend Tristan Fernandez.
Absolutely, Tim. I'm doing my part. So currently, the legislative interim, we are currently in the legislative interim. Session ended March 7th, 2024. The next legislative days will be May 29th through 31st. So that'll be the next time that this group, probably April and others, may have some time for the legislature to make some of those requests that we're talking about and some of the things that we've been talking about throughout the last legislative session. So just as a high level overview, in 2024, we had 291 unique bills and resolutions. 104 of those bills were assigned to child welfare. Of those 104, 30 passed and were assigned to child welfare for implementation. You heard a little bit about House Bill 4086 from Lisa, but I'll share a few additional highlights from this last legislative session that just ended. Senate Bill 1557, also known as the Culture of Yes Bill. It directs the Oregon Health Authority and the Department of Human Services to pursue federal funds to provide youth pursue federal funds to provide youth who have complex needs services, specifically called the K Plan. And it also limits when a young person can be removed from a current placement, specifically around hospital settings, and disregards their parental income for the services who meet those eligibility requirements under having complex medical health needs. There were two pretty major pieces of legislation, I think, that folks might be interested around child advocacy centers. Folks that have followed the legislative session for a while will know that funding around child advocacy centers has been hotly contested within the legislature. House Bill 4140 and Senate Bill 1579 specifically tried to tackle those. One is does some current funding requirements through grant programming, and the other one requires the Department of Justice to request funds for child advocacy centers annually. Some additional budget highlights I want to throw out there is that $86 million in general funding was allocated for the employment-related daycare program. That funding doesn't go through DHS; it does go through the Department of Early Learning and Care, but it would directly impact a lot of the families that we serve. Another major piece of legislation in House Bill 5204 had a lot of elements of the funding related to the changes around Measure 110. It provided an additional $221 million for a lot of behavioral health pieces. And the biggest chunk of that was $85.4 million for behavioral health residential beds, crisis stabilization centers, and sobering centers, as well as substance use disorder capacity investments across the entire state. So those are just very big, high-level items that came out of this last session since last we've met that I wanted to make sure and share with you. And I will pass it back to Tim. Thank you.
Thank you so much, Tristan. Appreciate that. That's it for our Q&A today. We are running out of time, but April, do you want to finish us off here on this chat?
Sure. So thank you all so much for joining us today. I hope you all got some information out of our updates. They are reflective of your hard work. It's what's causing the positive conversations that are stirring across the nation. I'm super proud of Oregon and your work and our work, and to hear about how we are making waves in transforming child welfare nationally. We loved having our guests from District 1. I couldn't be prouder of them. I appreciate you all for sharing your experiences. It's true that change is hard, and I really appreciate D1 for taking hold of this challenge and really making it yours, and doing so in a collaborative and productive way. You all have been centering families and children, and that's really our goal. And what you've done has stellar impacts to relative placements. Nobody puts baby in the corner. Nobody's putting Oregon in a corner. With that, vaya con Dios, all. I hope you have a good rest of your April, a good rest of your spring, and that you absolutely do all the things that you put in the chat around enjoying the spring, including taking your Claritin. Hasta la vista.